Ever wondered what really happens in those critical moments when paramedics respond to a seizure? Today we're cracking open their actual playbook. We're going to follow every single move, step by step, from that first 911 call, all the way to the moment they stop the chaos inside the brain.
Okay, picture the scene. It's chaotic, it's scary, someone you know is having a seizure. And you've done the right thing. You've called for help. But what happens in those crucial minutes before you ever get to a hospital? How do paramedics walk into that chaos and turn it into a structured, life-saving response? Well, that's exactly what we're breaking down today.
It all kicks off with that 911 call. That one call sets a whole system of highly trained people in motion. But for those responders rushing to the scene, the first challenge is just understanding what they're racing towards. What's actually going on inside that person's brain.
Forget all the complex neurology for a second. The absolute best way to understand a seizure is to picture this: a sudden, completely uncontrolled electrical storm just firing off inside the brain. This storm is what causes all the physical things we see on the outside. And a paramedic's #1 job? Find a way to calm that storm.
So when the paramedics arrive, their very first priority is to bring order to the chaos. They are trained to systematically figure out what's going on. And believe it or not, that process doesn't start with treatment, it starts with an investigation. And here's what's so critical to understand. Paramedics aren't just treating the seizure itself, they're hunting for the cause. See, every seizure has a trigger, and finding that trigger is the key to giving the right treatment. They basically become medical detectives on the spot, and they start their investigation by looking at two key things: the patient's history and the physical evidence.
So they immediately start firing off questions, and each one is like opening a different door. Have you had seizures before? That could point to an ongoing issue. Any history of diabetes? Maybe it's dangerously low blood sugar. They'll ask about recent trauma, which could mean a head injury. Alcohol withdrawal, pregnancy, a potential overdose. These are all critical clues right out of their protocol, and each one points them down a different path.
And at the exact same time, they're scanning for physical evidence. Did anyone actually see the seizure happen? That's a huge piece of the puzzle. They'll be looking for any signs of trauma, checking the patient's mental status, and doing a super quick blood sugar test. They're literally piecing together the "what happened here" story from every single angle they can.
Now, after this super fast investigation, and we're talking it happens in just a couple of minutes, the entire situation funnels down to a single critical decision. This one question determines absolutely everything that happens next.
And this is it. This is the big one, the fork in the road. Is that electrical storm happening right now, right in front of them? The answer to this simple yes or no question dictates the entire treatment plan and splits the official protocol into two very, very different paths.
If the answer is no, the patient is now post-seizure and the focus completely shifts to supportive care and trying to figure out the cause. But if the answer is yes, the mission becomes singular and incredibly urgent: stop that seizure. So let's follow that yes path.
Okay, so the patient is actively seizing. The clock is ticking. The protocol now provides a crystal-clear, step-by-step action plan designed for incredibly rapid intervention. There is zero guesswork here.
So how do you calm an electrical storm in the brain? Well, you use a specific class of medication called benzodiazepines. In this particular guideline, the drug of choice is midazolam. Its job is to get into the brain and essentially just turn down the volume on all that out-of-control electrical noise.
The protocol lays out the next steps perfectly. Step 1, administer the medication. Step 2 is immediate monitoring. They're going to get an IV going, give some oxygen, and hook up a heart monitor. They'll also check how well the patient is breathing with a special tool and recheck that blood sugar. Step 3, reassess. Is it working? And if that seizure is still going, they move to Step 4, a second dose.
That number 5 is so important. The protocol requires a 5-minute wait before giving a second dose. And this isn't just some arbitrary number, it's a critical safety window. It gives that first dose time to actually work and, just as importantly, prevents an accidental overdose. It's a failsafe that's built right into the plan. But how do they actually give the medication? Well, they have two main options. If they haven't gotten an IV line started yet, they can give an injection right into a muscle. That's IM. It's fast and it works. But as soon as they get that IV access, they'll usually switch to that route, because it puts the drug directly into the bloodstream for much more precise control. It's all about using the fastest, safest path available in that exact moment.
And a really great protocol is never a one-size-fits-all deal. This guideline tells paramedics to consider cutting the dose in half for patients over 65.
And if the patient is pregnant or has just given birth, it triggers a completely different set of considerations. This just shows how the care is so carefully tailored to protect every single type of patient. So, the medication has worked, and the seizure has stopped. Now, while the immediate crisis is over, the work is not done. The focus now shifts to the aftermath and getting the patient ready for a safe handover to the hospital team.
And this is key. The end of the seizure is really just the beginning of the next phase of care. Paramedics are going to keep monitoring breathing, heart rate, and mental status the entire way to the hospital. They've calmed the storm, but now they have to keep watching the skies to make sure it doesn't come back.
You know, when you look at all these steps together, you see the real hero of the story isn't just a person or a single drug. It's the protocol itself. It's this pre-written plan, built on evidence and experience, that empowers professionals to act calmly and effectively, even when everything around them is completely frantic.
And that leaves us with a final thought, right? We often celebrate big medical breakthroughs, but we rarely think about the systems and the guidelines that actually deliver that medicine safely. So the next time you see an ambulance, just remember that inside there isn't just a bunch of equipment. There's a carefully crafted plan, a roadmap through chaos that's designed to save a life.